Welcome to the Behavioral Health session of the Cross Systems Training. I'm Julie Radlauer with the Ronick Radlauer Group. What does the term behavioral health mean to you? Technically, behavioral health is often described as the connection between our behaviors and the health and well-being of the body, mind, and spirit. For our purposes here today, we are also referring to mental health and substance use and the community resources available to support people that are experiencing behavioral health conditions. Let's see what these people have to say about behavioral health, wellness, and recovery.
What are some of your wellness tools? I pray, I listen to gospel music, I go to church, and I read.
I walk 2 hours, that is almost 12,000 steps. I also have my meter here, and food. I eat really extra food, really healthy food, and I do detox diets, like has helped me I lost 50 pounds.
I would say one is exercising for me. Another one would be eating right.
And what I do also, I go to a massage once a month, and I do gardening in my apartment. I am growing bonsai trees now, and also I visit friends and family members, and I like to meditate and listening to TED Talks with my husband.
Eating healthy food, going to school, exercising, and keeping a positive mindset.
What does wellness mean to you?
So to me, wellness means mental and physical health. So I feel like when you're well, then you should eat healthy, you should exercise, make sure that you're healthy socially, make sure you have friends, you don't want to be isolated, make sure you have free time, and make sure you don't neglect yourself. You put yourself first, even though you do stuff for others, but you have to make sure you're taken care of.
Wellness means where you are spiritually fit, mentally, physically, and spiritually, and things to do that you're doing on a daily basis to better your life, spiritually, mentally, and physically.
I think wellness means taking care of your body, being healthy, and loving yourself.
For me, wellness means my mind, body, and spirit are all becoming in alignment, and that it is a great place to be when I can connect those. And when one of those things are kind of out, then I have a great support system like South Florida Wellness Network, woo! To get all those things back in alignment, and so that's what it means to me.
Perfect answer.
Now that we have an understanding about how the community views behavioral health, let's hear from some local experts. Today, I am joined by Dr. Steve Ronick, CEO of Henderson Behavioral Health Center. Dr. Ronick, thank you for taking the time to speak with me today about behavioral health resources in Broward County.
Thank you, Julie, for inviting me to be here today.
Will you please take a moment and share with us how Henderson Behavioral Health strives to meet the needs of people experiencing mental health and substance use conditions?
Henderson is one of the oldest, largest, and most successful providers of recovery services for persons with co-occurring disorders in Florida. We utilize research and evidence-based practices combined with a wide range of supports to treat the whole person rather than just the illness. Henderson provides health care, housing, and hope for over 30,000 people of all ages with behavioral health conditions in Florida every year. And through care, supported employment, advocacy, housing, Henderson assists and inspires people with mental illnesses and substance use conditions to reclaim their lives.
We know that people define behavioral health in many different ways. Please take a moment and share with us how you define behavioral health and a little bit about the scope of the problem. How many people are affected by mental health and substance use conditions?
Behavioral health includes mental health and addictions or substance use. And across the United States now, it's been estimated that almost 50% of United States adolescents met the criteria for mental health conditions. And of those, the largest percent was affected by anxiety. Further, of the other 50% affected, over 22% experienced severe impairment in functioning.
That's certainly a significant number of youth experiencing mental health conditions. So when you need help, where can you turn for assistance? What services are available to support them in Broward County?
Well, in the behavioral health field, we try to assist kids and their families by providing services where they live in the community. Further, we strive to provide services in the least restricted environment so not to disrupt the youth or family further. The levels of care include a range of services from community-based, such as outpatient therapy, in-home therapy, or case management. And if that doesn't meet the needs of the client, then there are day treatment or psychosocial rehabilitation services available as well. If a youth needs further support, they may be able to access therapeutic foster care, group homes, residential treatment, or eventually SIP, which is a statewide inpatient psychiatric placement.
That's a wide array of services. How are these services paid for in Broward County?
Well, funding for behavioral health comes from a lot of different places. It includes the federal government, the state of Florida, the local managing entity, which is the Broward Behavioral Health Coalition, Broward County government, our CSC, or Children's Services Council, United Way, private foundations, private pay, commercial insurance, and Medicaid, which is actually one of the largest funders for children's behavioral health in Broward and in Florida.
So if a person or a family is trying to access mental health or substance use services in Broward, where would they call?
Well, there are many service providers in the community available to support families in need. The first and logical place to start would be 211 Broward. They're available all day, 24 hours a day, 7 days a week. They make linkages and referrals based on the needs identified during the call. You can also call Henderson Behavioral Health directly. Henderson has a wide array of services, including centralized case management throughout Broward County. Henderson's centralized case management utilizes a wraparound model and works with complex children and their families. Another excellent resource would be the Mental Health Association, which is a peer resource in the community. They also provide a great book called the Connections Book that a lot of professionals utilize on a regular basis. Furthermore, you could contact the South Florida Wellness Network, which is another peer support organization that has both peer support and a program for youth peer support called Youth Move. There are also a lot of excellent service providers in Broward County, so families really should try to access services close to where they live.
Thanks for sharing some of the best kept secrets in Broward County. What are your suggestions for a family that's experiencing a crisis? Who would be the best contact in that type of situation?
Well, if someone's really in imminent danger, then the first call always should be 911. But if someone is concerned about someone else hurting themselves or somebody else, then they feel that support would resolve the situation, then they can contact Henderson's Mobile Crisis Team. For kids, the team is called the Youth Emergency Service, or YES Team. The YES Team will come out to the home, school, or community and assist in de-escalating the situation and determine and evaluate if the person needs further psychiatric assistance. If there isn't an emergency situation, the family or community service provider can always attend a family service planning team meeting. FSPT is an interdisciplinary team of community-based professionals that will assist in community planning. And the family service planning team occurs every Wednesday, so they can easily call 954-677-3113 to make an appointment for support and for planning.
I'm also aware that there are a few community-based positions designed to support caseworkers. The SPOA, or the Single Point of Access, is available for ChildNet staff when they need behavioral health assistance with a client. There are also 3 Broward County Behavioral Health Liaison positions dedicated to providing linkage and referral to juvenile justice, ChildNet, the school system, and primary health system. In addition to support and planning, sometimes a person needs to be hospitalized because they're a danger to themselves or others. Will you please explain this process to us?
Yeah, what you're speaking about now is referred to as the Baker Act. And in the early 70s, the Florida Mental Health Act was created, and it is known as the Baker Act. The Baker Act allows for involuntary examination of an individual who is at immediate risk of self-harm, harm to others, or is self-neglectful. The Baker Act is often used when a person has a mental health condition and they are in need of immediate care. The Baker Act is frequently reviewed and was actually updated in 2012 to include some provisions about outpatient care. The Baker Act also allows for up to 72 hours or 3 days for examination by a psychiatrist in an inpatient hospital setting. Possible outcomes of the exam could include discharge from care, voluntary inpatient admission, involuntary inpatient admission, or now actually involuntary outpatient treatment placement.
So what is the process when somebody who's using substance needs assistance?
That's when a family member could access what's referred to as the Marchman Act. The Marchman Act is a court-ordered assessment for substance abuse services that includes a recommendation for care. A parent can file a petition for this assessment at the Broward County Courthouse, which is located on the second floor, room 250 at 201 Southeast 6th Street in Fort Lauderdale. Hearings for the Marchman Act are actually held every Tuesday. The petitioner must provide proof of substance use to the general master. If the child refuses to comply with the recommendations, the family must complete a petition for treatment within 90 days of the initial assessment. The provider will then receive a court order for treatment and is responsible for filing what's called a rule to show cause if the child does not attend services. This is a pretty technical and complicated process, and sadly can be challenging for families to navigate, but it is an option for kids in need of substance use treatment.
Well, Dr. Ronick, this has been very informative. I truly appreciate your time and value the knowledge that you have shared with the community. If you have further questions, please feel free to contact Broward Behavioral Health Coalition at 954-622-8121. Let's talk a little bit about how a system of care is implemented in the behavioral health system. In Broward County, we've been utilizing wraparound to operationalize system of care values. Today, we are going to speak with Sherry Thomas, who's the Director of Youth and Family Services for Henderson Behavioral Health. Henderson has been implementing wraparound in Broward County since 2003. Welcome, Sherry. Thank you for being here today.
Thank you.
Okay, so let's just start off with what is wraparounds?
So what is wraparound? Wraparound is a support and planning model to help children and families have a better life.
So what kinds of values or principles are included in the wraparound process?
So wraparound is strength-based, it's culturally competent. There's a couple of mottos that we use to explain wraparound, which is no planning about me without me. It's a do for, do with, cheer on approach, looking at each child and family, one child and family at a time. So we create individualized plans of care for each child and family based on their unique strengths, culture, needs, and preferences.
So how do wraparound case managers make the job of child advocates or juvenile probation officers easier?
So one way that the wraparound case managers make their job easier is by dividing and conquering. So oftentimes advocates and JPOs have a larger caseload than the wraparound case manager. So while the juvenile justice probation officer is looking out for community safety and the child advocate's looking out for permanency options, the wraparound case manager is looking out for the behavioral health needs.
Okay, and so what can a child advocate or a juvenile probation officer expect from their wraparound case manager?
So they can expect that we will help with things like transportation, we'll go to court, we will give updates regarding whether or not they are linked to a behavioral health provider, whether they're getting therapy. When they're charged with making sure these kids have access to behavioral health services, we will take the responsibility of exploring and making sure that services are being delivered based on their needs defined by them, and making sure that we don't just link and refer, but also do a warm handoff, meaning that we have a name and a number and we're providing updates so that they're not going into court blindly, not knowing what's going on, or having to dig for information regarding the behavioral health needs of these children and families.
Okay, and so how would system partners know when a case manager has made a referral on a child?
Okay, so if a JPO or a child advocate make a referral for a wraparound case management, we will immediately get back to not just the family, but to the referral source. And then monthly, they could expect to be invited to a team meeting. Some basic principles about wraparound are no planning about me without me, for example. And since both of those roles are so important to the process, they'll be invited, and it can be expected to be invited to participate in a team meeting around the child and family.
Okay, and so a probation officer or a child advocate would definitely expect to hear from a wraparound case manager monthly for a team meeting. How frequently would they hear from them otherwise, or what other contacts might they have from a case manager?
So they might get a summary of what's happening with that child regarding community service, regarding therapy, how they're doing in school. They'll be invited to the meeting really because we want to have no planning about me without me. Wraparound is a do for, do with, cheer on process, meaning that for some of the families we're going to do with them in the case of riding a bus. We might give one a bus pass from the child advocate. For another one, they might need someone to ride the bus with them, and then we cheer them on. So those steps of wraparound are do for, do with, cheer on, and we need the advocate and the JPO to participate. But we're also going to make their job easier by taking some of that stuff off their plate and keeping them informed of what's happening.
Okay, and so what are the hours of case managers? Are they wraparound case managers? Are they available just between 9 and 5, or are they available after hours as well?
Nope, they work flexible schedules, so they're not leaving you high and dry Friday at 5 o'clock. And they're there to work, whether it's when they come home from school early in the morning. One might need a phone call or a lift getting to school in the morning. One might need to be seen after school. Some may prefer a Saturday morning. Wraparound's really based on the individual needs, preferences, culture of each person that we're working with. So the plans are individualized. It's not a one-size-fits-all approach.
Okay, and so you guys have been implementing wraparound at Henderson for a pretty long time. What kinds of outcomes have you seen from this process?
So we have seen, back in the day, there must have been about 400 kids in out-of-home care. So we have seen that there's much less children in out-of-home, therapeutic group home, and residential placements as a result of wraparound. We know that kids really want to live in their own community with people they know, involved in activities that peers of the same sex, age, race, and culture are involved in. So we have seen better attendance, less hospitalization, less SIP placements, more kids involved in more social activities. We've tried to bring more natural supports to the people that we're working with.
Okay, it sounds like it's been a really effective program.
Yeah.
Thank you so much for sharing today.
Thank you for having me.
Now, we are going to watch a brief video from the Children's Services Council talking about the peer support movement and how youth and families can seek alternatives to support for their mental health and substance use needs.
Mental health has gone through a place of having great stigma attached to it, which I think is starting to change now. Sylvia, in my opening, I talked about how it's really being discussed in legislatures and living rooms all over the place, and this new approach. Can you talk about how Broward Behavioral Health is involved in those changes that are happening and what your vision is for the future in Broward County?
Sure. I think that, number one, we're very lucky to have a community-driven organization where on the board is a non-for-profit organization, and on its board basically sit all the stakeholders and key partners from the community that are interested in providing a good quality and wellness type community living. And we have to think about that because it's mental health is about the wellness in our communities. And it's crucial that we're all part of whatever role we have to play in getting that going. Traditional mental health services have usually been provided by professional organizations or people that graduate from colleges and universities, and to some degree has reached a certain part of the population and has been successful at that. However, there's another part of the population, as things have changed, they have not been reached. And as we don't reach them, they get more in trouble and they become more complicated into other systems that basically at some point they're not reachable anymore.
So being able to get to them early through whatever means necessary
exactly, is helpful.
Yes.
And those difficult clients to reach or individuals to reach, which the professional world has not really been very successful at, can be reached by using an essential component that has come out recently, which is the power of the peers. And it has to do with trained individuals that have had experience in that field of our target group that are trained and they're certified so that they can help engage and provide hope to those individuals that are at a point in their lives where they think that, it's not worth it to live anymore, and I don't see the hope anywhere. I'm never going to get out of the hole that I'm in. And so here comes a new development in our professional process for providing treatment that has to do with engaging and training and building the capacity for peers to work in collaboration with professionals so that we can engage those individuals, and then the professionals and the peer together as a joint team can really reach out to those families and provide the supports that they need and the services they need.
I hope you enjoyed that video. As you can see, there are many different needs in the behavioral health, as well as a multitude of interventions and treatments. Thank you all for tuning in for the behavioral health session of the Cross Systems training. A special thank you to South Florida Wellness Network, the Children's Services Council of Broward County, Broward Behavioral Health Coalition, and Henderson Behavioral Health.